It gives me great pleasure to welcome everyone here tonight to Boston College, and in particular to this beautiful, newly renovated Gasson Hall that we all have the pleasure of being in. I also welcome you to the second offering of the Dean Series, sponsored by the Boston College Alumni Association's Alumni Education Program. Dean Gennaro is the second of 4 Boston College deans who will be trading their dean's hat for a professor's cap during this academic year by offering lectures that are open to all alumni from each of Boston College's undergraduate and graduate schools. Dr. Susan Gennaro is Dean and Professor of the Cannell School of Nursing here at Boston College. Dr. Gennaro's research focuses on the improvement of perinatal health and has been conducted in the US, Malawi, and Uganda. Dr. Gennaro's long history of funding from the National Institute of Health has also focused on improving nursing education, and she currently serves as the leading nurse scientist on the Harvard Catalyst, the clinical and translation science initiative of Harvard Medical School. Along with many additional honors, Dr. Gennaro is the editor of Sigma Theta Tau's Journal of Nursing Scholarship. She is a fellow of the American Academy of Nursing, and she has been recognized for her outstanding contributions to maternal and child health by the Distinguished Service Award of the Association of Women's Health, Obstetric, and Neonatal Nurses. And I believe I speak for students and alum alike when I say how grateful we are for the talent, energy, and enthusiasm Dean Gennaro brings to the Cannell School of Nursing. It is so appreciated and wonderfully contagious. And so without further ado, please help me welcome Dean Susan Gennaro.
I can't believe that so many people came out, although it is a nice day. So thank you for doing that. It really makes it a great pleasure to be here. And let me just ask you, how many of you are in healthcare? Ooh, a lot of you. So how many of you are nurses from the Cannell School? Oh, very good. How many of you are physicians? Social workers?
I'm a volunteer.
You're a what?
A volunteer.
A volunteer. Excellent, because I was going to get to the point where I wasn't going to ask the right kinds of categories. It gets hard. So thanks for your help. And I would really like to keep this as interaction and as informal as possible. I didn't wear a dress that helps me with the lavalier mic, so I mean, you can't be perfect. So I'm going to stand here and kind of do all these things at once, but I do much better with people saying, wait a second, I don't agree with you, or stop, or if you're going to say you don't agree with me, you could be more polite than that. You can tell I come from New York. But really, I think that this is for us to be able to have a dialogue and a discussion. So I was asked to speak about 21st century health and wellness. And so I'm going to start out with the sad news that we are not doing so well in terms of health in this country. Anybody want to disagree yet? And why do I say that? Because, in fact, here's my name. Here's my email address in case you want to tell me something or send me a fabulous article or you have a joke or anything else that you think I'd like. I always put my email address, and I get some of the best comments from people, so do feel free to email me. Okay, so why do I think that we are not the healthiest that we can be? One reason is that we spend more money than any other developed country on health care. Our per capita health care costs in this country are over $7,000 a year. That's, let me just give you some other numbers. Italy spends almost $3,000 a person, Ireland almost $4,000, Switzerland almost $5,000, but we're $2,000 more than any of those other developed countries. And do we have better health statistics? How many people want to say yes? See, we are smart people from Boston College. We know that that was a setup. So no, we're not. If you look at life expectancy, we have a life expectancy that averages about 78 years. Ireland is 80, Italy is 82, Switzerland is 81. That's only one measure of health, but if you look at infant mortality, neonatal mortality, any kind of information that's collected around the world, we are the most expensive and we're not with the best healthcare outcomes. And there are a lot of reasons for that. So we talk about how we're a very, very large nation. Hard to have one kind of healthcare fits all, much easier if you're Switzerland, and it's easier to get transportation to places than having to provide the same kind of healthcare that's going to work in New York City and Montana. Two very, very different places. Okay, so that's true. We know that we are a country of immigrants, and we have a lot of health disparities, and so because we have different populations and we have health disparities, everybody isn't getting the same kind of care. So that's another reason why people say, oh, well, but you have to realize America's different, although we all know that the people who really immigrate are much more likely to be healthy people than the people who stay home because they're not healthy and they have problems. So that argument doesn't always work for me. But no matter what the story is, we know that around the world, 70% now of the healthcare burden is from chronic diseases. Same in the United States as it is other places. And we're spending the most money on those chronic diseases with not the best outcomes. So I'm going to talk a little bit about some things that I think would help the healthcare system, although we certainly need multifactorial approaches to fixing things. And one of the things that is going to make a difference is preventative health care. So I'm going to talk a little bit about that, and I'm going to really challenge us to think about how healthy we are, how much we can do to be healthier, what we're interested in committing to do. How many of you think you're as healthy as you want to be right now? Okay, well, it's all right to have healthy people. I'm for that. I'm a nurse. Anybody on that side of the room? We have healthy people on this side of the room. On that side of the room, it's not so true. Okay. So, we're going to talk about health promotion also. So, this is a great article on over almost 20 years of research, systematic review that was done on advanced practice nurses and outcomes. So, I wouldn't be the dean of the Connell School of Nursing if I didn't tell you, since we have nurse practitioners, clinical nurse specialists, and nurse anesthetists who graduate from the Connell School, that one of the answers to the healthcare problems that we're having is having appropriately educated nurses who can function to their full scope of practice. Anybody want to disagree with that? And it would be foolish to disagree with that, because not only do I have this great article here by Robin Newhouse that was in Nursing Economics in 2011, but the Institute of Medicine and the Robert Wood Johnson Foundation have come out this year with a report called The Future of Nursing that's really said, in order for us to have access to care in this country, we have to use the healthcare providers that we have to their fullest abilities and in a better way that's more cost effective. And this study, when it looks at all the outcomes of advanced practice nurses, finds that there are fewer hospital days in the hospitals that have clinical nurse specialists. There are fewer readmissions to hospitals and hospitals that have transitional care provided by nurse practitioners. There are, in fact, better access to care with nurse practitioners. And we know in all the studies that have been done that there are equally good outcomes when you have the appropriate patients that you're seeing between physicians and nurse practitioners, with nurse practitioners doing a really good job in terms of changing behavior. And since I just said we do better with that, since I just said that 70% of the chronic diseases in this country, 70% of the healthcare burden in this country, and in fact around the world, is because of chronic diseases, we really need people who are helping us with our health behaviors. So nursing has a good place to go with that. I feel like I should say, because I am married to a nurse. Did anybody know that? and my husband is here, he's a nurse anesthetist, and they are another kind of advanced practice nurses. 60% of the anesthesia in this country are given by nurses, 100% of the anesthesia to the military. So using people appropriately in the right time with the right patient population is cost effective, and not that it's all about money. I don't want you to think that I am really fixated on the money piece. But it is amazing that in 2005, we spent $2 trillion on healthcare, and in 2011, it was up to $2.3 trillion. How many of you deal with budgets? And so who doesn't worry about rising healthcare costs? It's a real problem for every place I've been, because the amount of money that we're having to put into healthcare for the people that are working with us in benefits has gotten to be more than we can easily afford. Boston College has started a fabulous wellness program that was kicked off the beginning of last year, just for this reason, to try to decrease the costs of healthcare. So it's really one of those things that one of the answers for how it is we can help the healthcare system is using the right kind of providers. Part of it is preventative healthcare. We started really talking about this back in the 90s when Bill Clinton started talking about universal access to care. We know that the only state that that's true, that exists, is Massachusetts. We know that there was a large interest in managed care companies and the savings we could get from managed care. We think we've gotten as much savings as we're going to get. We worry about health insurance now, and there's a lot of debate about what is the best kind of insurance, single payer, the state. Medicare and Medicaid are cheaper than other insurers, but then people say, yeah, but what kind of services are being provided? And so do you get what you pay for? And so there's a lot of discussion about how we're going to finance health care, but part of the healthcare answer is clearly going to be on providing evidence-based, cost-effective care and preventative health. And, you know, it's estimated that 30% of the health care people get is not helpful, doesn't have outcomes. So we don't really need to spend 30% of the money on things that don't have any positive outcomes. So we are really interested, oh, very cute. We're very interested in how it is we're going to change the system. And I would like to think that we're really going to change it not through any kind of magic pill. This is my slide of magic pills, which we're looking for. And if I could find the magic pill, I know I could make a lot of money because we like magic pills in this country. But there are no magic pills. And so part of the answer in terms of prevention really is a question of what is it we're doing for our lives. And there was some great research done a while ago by actually a nurse researcher at Boston College who did studies on how people change their health behaviors. How do you decide if you're not eating the right things to change what you're eating, or if you're not exercising, or if you are smoking, or if you're drinking too much or taking drugs or whatever? And she found that one of the things that created change when you started to talk to people and said, why did you start whatever? The big answer was that people had a moment, whether it was, I tried to put on those pants and it really didn't work. And I thought to myself, I am not going out and buying a new wardrobe. It's not going to happen. Or it was a question of people who drank too much waking up somewhere and not really knowing how they got there, not really remembering what had gone on. Or it was a question of somebody saying, oh, go away from me, I can't stand your breath because they smoked. Whatever it was that was that aha defining moment, help people to say, okay, I'm going to do something different. So I am hoping that we're going to spend some time today thinking about our health, because 2 of you raised your hand, or maybe 3, and said you were as healthy as you wanted to be. You could actually go home now, because I don't know that I'm going to say anything that's going to be so great for you. But everybody else who didn't raise their hands has something that they'd like to think about changing. And I'm hoping that tomorrow when you wake up, some of you, I would hope for all of you, will have a defining moment that says, you know what? I can do one thing. I can do one thing, and I'm willing to do this one thing. So it's what makes you start. And I'm going to tell you that my daughter, who I should say our daughter, got married June the 4th at St. Ignatius Loyola Church, and we had a fabulous reception at the Boston College Club. And in January, I woke up and thought, I'm going to be in all these pictures. And I do not have time to lose 100 pounds because it's January. That was a sad but true thing. She was engaged for 2 years, so why I didn't start this earlier is a question that we're not going to ask because that will only depress me. So I had to do something really quickly, or I felt like I needed to do something. And so a friend of mine actually dragged me to a physical trainer. I can do all kinds of things that I didn't used to be able to do. Look at this. Want to see my lunges? I'm great. Thank you. I am really good lunging. I can do all kinds of things I didn't used to be able to do. And my trainer will be glad to know that I'm sharing that with you. Really. It's unbelievable. So I thought, well, I'm not going to lose 1 million pounds, but at least maybe I can be a little healthier. So I went, I started going, and then, you know, you're doing all this exercise, and so maybe you shouldn't eat as much. And so I am happy to tell you, I'm really very proud of myself. Not that you could tell this, but since that day in January, I have lost 30 pounds. Which, you know, I've lost 1 million pounds in my life and gained 1 million pounds in my life, unfortunately, but what is it that says, okay, I'm going to change and I'm going to do something different? It's that one thing at a time that says, here, I really don't want to be part of the chronic disease brigade. I am really interested in doing something different. So how many of you, when it comes to your health, would like to do something about your weight? Okay. Now, see, this is where you have to worry about social desirability because nobody ever raises their hand on this one, but I know by the statistics. How many of you smoke? I've had mothers, because I'm an OB nurse, tell me that they do crack cocaine who would not tell me that they smoke cigarettes. No, I'm telling you, it's very socially undesirable. But okay, you know who you are, and we're going to come back to it, whether you're admitting it or not. No, I mean, it's the truth. How many of you get enough sleep? Enough. Which would mean some of you are not raising your hand because you don't get enough. No, getting sleep is good. How many of you exercise adequately? Ooh, this is very impressive. Now, what's adequately? 30 minutes a day? An hour every other day? Any exercise is fabulous. So I just read an article from the Lancet in 2011 that said if you exercise 15 minutes a day, you live 3 years longer. I don't exactly know how they figured that out, but you know, exercise is a wonderful thing. Anybody wish they were exercising more? Okay. All right, so we're going to talk about how it is we get to this change. What's going to help us to be that magic pill? All right, so we'll start with the easy stuff since no one's admitting smoking. And here's the fabulous thing about smoking. Now, you can tell I'm a woman of a certain age, which will remain nameless. But in the home movies around my family's Christmas, all the women have these fabulous hats on. Everybody wore hats, I don't know. They all had gloves, and they all had a cigarette dangling out of their mouth like you wouldn't believe. They're over the turkey with the cigarette. I wonder what it was like. I have no memories of all the smoke. Okay, so although I am older than I once was, my children, who are also older than they once were, used to, when we were riding somewhere and they saw somebody smoking, or if we were in a restaurant and there was somebody smoking, they had this little song they sang that went like this: emphysema, emphysema. Now, we lived in Philadelphia, so I worried about what might happen to us with this kind of behavior. Thank God we didn't live in New York, because that wouldn't have been good. I'm sure we might have lived in Boston. But what happened between my parents' generation with the cigarettes and my kids' generation with the absolute outrage that anyone would smoke. What happened was we really did something fabulous about health in the United States. We had started having all the great American smokeouts. We went from being the Marlboro Man to saying it's not okay. And it was a wonderful thing because we know that there are 443,000 smoking deaths a year. Now, you know, I was at the University of Pennsylvania for a while, and so if you really cared about money, the best way to solve healthcare problems is to have everybody smoke because people die of lung cancer in their 40s and it's a quick death. So it doesn't, no, this is the truth. They did studies. It doesn't cost the system a lot, but that's a horrible thing, right? We would not support that because we are Boston College. So this is, we would not. This is not an ethical social justice kind of thing. So that is not the answer. Money isn't everything. But we really would like people to stop smoking. And smoking is the one behavior that if we changed it would prevent the most deaths in the United States. So I'm glad that nobody here smokes. I'm even beginning to believe it. But it is the thing that could prevent the most deaths. It is a problem for kids. So do you have any younger kids in your life that you think smoke? I mean, my niece smokes. Is that why you raised your hand, or do you know something I don't know?
Today I was at work and I saw this coworker. She's 6 months. I was pregnant and she was smoking. And I was like, sad.
So for the, I have to repeat this for the tape. This woman is saying she saw a 6-month pregnant woman today who was smoking. You're what? Oh, a coworker who was smoking, which is very sad. I would be sad too. We know that in terms of who is smoking, that there's a real decrease in the number of adults that are smoking, a real increase in the number of kids that are smoking. 82% of adults who have ever smoked started smoking by their 18th birthday. So there is that point about how are we thinking that it's okay. And you know, a lot of women smoke. More young women are beginning to smoke than men. Much of it has to do with weight control. I can eat if I smoke, which is really too bad because it is such a horrible piece in terms of health. So you might ask me why I'm telling you if smoking's so bad, why I'm telling you how many nurses smoke. And I'm telling you this, fewer nurses than used to, but because it's not just knowing how bad it is for you, knowing things doesn't change behavior. It's not only do you know, and I don't think anybody doesn't know that smoking is bad for you and causes cancer, but it's the knowing and then being able to put the other things in place that change your behavior, give you a safe place to be. We're going to talk about all of those kinds of things. So I think it's really important that we're able to sit there and say, what are we going to do that's going to make us and the kids that we love and want to have long, healthy lives really prosper. I was just looking at some data from the Nurses' Health Study. You know, the physicians at the School of Public Health at Harvard have been following a cohort of nurses for a very long time. And anybody in the Nurses' Health Study? Fabulous. And what a real gift. Thank you for doing that. They're actually entering a new cohort. If you know any nurses that are under 40, they're looking for a new group of nurses to enter and follow. But as they looked at smoking in the nurses cohort, no matter when you quit, huge difference in longevity. So even if you smoked once, ending smoking is a really great thing. And we can see that people are doing that. Okay, so here's the one that, for me, I really don't smoke, but it becomes the bigger problem, which is weight management. 46% of American women are overweight. I care about nutrition and not just weight, so we're going to talk a little bit about nutrition, but we know that if you're an adolescent who is obese, you have a between 50 and 95% chance of being an obese adult. If you're a baby that's overweight, you only have a 15% chance of being an overweight or obese adult, but the older you get, the worse it gets. And we know that we're seeing huge increases in the rate of obesity among children. I'm sure you've all watched countless programs about we don't go out and run around enough, we're playing too many video games, and there is an exercise in what do you eat difference. We know that medical costs associated with obesity were 147 billion in 2008. Somebody who was overweight or obese cost almost $1,500 more for health care than people who were normal weight. So that's pretty startling. We really would like to do something about that. So here's the weight management's really crucial, but we want to make sure we are having a healthy diet. There are a lot of preventable deaths. 60% of Americans now are overweight. Have anybody been abroad lately? And so when you look around, do you think to yourself, oh, those must be Americans over there? And is it the sneakers? So what was the clue? Yes, and I'm going to show the BMI chart in a second. The question was this from the BMI? Because it's important to be able to know where you fall. Are you normal weight or are you not? So we're going to look at that in a second. That's exactly where this came from. 300,000 preventable deaths a year. The number of obese children has doubled in the last 30 years. So that is really pretty startling. And this is, of course, really a global problem. It's not just in this country. So this is a hard chart to look at. I have to see if I can find my pointer, which I practiced with today, so we'll see how well I do with this. So anybody want to scream out their weight and height so we can see what... Oh, come on! Some of you are perfectly happy with your health, so you would want to scream out your weight and height. So how many of us would like to lose a little weight? We all would? You can never be too rich or too thin, is that our motto? Yeah. But you can be too thin. We have fabulous nurse researchers who are doing great research on anorexia and other things. There really is an underweight part of this too. So we don't all want to, but maybe a lot of us have to. So what's your number one best advice to give each other about one thing you could commit to when you leave here to lose some weight between now and Christmas? Okay, exercise. How many of us want to exercise? Oh, this side of the room is very big on exercising. Cook more at home. Don't go out to eat. What do we know about eating out? So I was sitting in front of this guy from Australia, eating out and eating too much, who said, you know, it's amazing to me the plate sizes in America. The portion sizes in America, every time I come, if I stay for any length of time, I really gain weight. And it's true. We've increased our plate sizes. We've increased our dress sizes. We've increased our clothes sizes. So that now what used to be whatever, you know, we think we haven't gained any weight because the sizes are different. Yes, we made them a little larger. So one great thing you can do is eat out of a smaller plate, because we should be doing that anyway. And we can eat at home. Okay, what else can you do? Eat breakfast. What intelligent person said that? This was an excellent answer, because women do not eat breakfast. And this is a very large problem in terms of weight loss. Then you haven't had anything to eat all night, you're starving, it's not good. One of the big things we could do is eat breakfast. What else can we do? Yes, sleep makes a big difference, and we've really looked, we have great sleep researchers also in the Canal School, and it is true there's a real relationship between sleep and eating. The tireder you are, the more you eat. Now, I have heard that. I don't know that in terms of research, but so I'm not discounting it, but.
I would say buy healthy snacks, don't buy, you know.
So we're going to talk about having a safe environment. For many years, I bought food in case my children came to visit. I really like my children. I'd like them to be happy if they came to visit. But they didn't eat any of those snacks. I ate them because they were there. So if they were going to come visit, I could just go out and get them something. I mean, really. Okay, other great things that help you. Yeah, now I'm a bad counting calorie type person because you could tell I'm not so good at numbers. So there's a little work in portion control and counting calories, but it is good to work to eat less than you exercise, yes. Fruits and vegetables, and we're going to talk about my healthy plate. We've gotten rid of the food pyramid. And that is a really big thing these days. Did you hear her? She said avoid sugary beverages. My healthy plate also talks about forget about sodas, forget about juice, let's drink more water. How many people really like water? I do not like water. But I'm learning to like water because it's a great thing. Other fabulous.
Just write down what you're eating in general.
So if you keep track, and there are a lot of websites that you can track in now if you want to do that. Not only people like Weight Watchers have everything online, but Live Strong. Anybody track their weight on a program they want to shout out? Yes. What? Weight Watchers. MyFitnessPal. MyFoodDiary.com. Much easier to do than it used to be. Okay, here are some things that I wish I had gotten the email about. Decrease how much you drink. All empty calories. No, it is. You know, so I have now made a new rule that says I can only drink wine on the weekend. I can't come home and have a glass of wine with dinner no matter how aggravated I am. Empty calories, I don't need it. This is an email I really wish I had gotten. So our daughter had this horrible accident and was on crutches when she was in college. She went to the same college where I was teaching. And she couldn't go through the cafeteria. It's very hard to be on crutches and eat if you're a college student. So I wound up having to go to the cafeteria more than I ever wanted to. And so one day I was having this nice lunch, and I decided I was going to go up and get some dessert. So I said, Liz, I'll be right back. I'm getting dessert. Do you want me to get you some? And she said, Mom, look at all those people by the dessert. Only fat people eat. Did you get that email? How many people got that email? I didn't get the email. Only fat people eat dessert at lunch. I did not know this. McDonald's is that we're going to get to fast food at McDonald's. Okay, so no dessert at lunch. Always eat breakfast. Back to this lady's point, really important to eat breakfast. Having an idea of how much you weigh is a helpful thing, because if you start to go up, well, we do have to decide what we're willing to do to change. So you just got this whole long list of things that other people have found are really work. And one of the questions that you have to write down and commit to, we might even ask for people who are willing to share, is there one thing you're willing to do for the next 3 weeks? It takes 21 days to have a habit. If you want to weigh less, is there one thing? Like I could give up dessert at lunch because I finally got the email. So we really need to think about that. Okay, but you did mention that one of the things that we have to balance is exercise and diet. So are you willing to exercise more or eat less or do both? That is one way to lose weight. It's not all about weight. I do a lot of work with pregnant women, and I am very concerned about people who are normal weights but who really eat very poorly. Especially women who are either pregnant or have just had babies. What I see all the time from the 24-hour diet recalls I do, I have this NIH-funded study right now that I'm doing at Jacobi Medical Center in the Bronx. People skip meals, don't eat breakfast, then get really ravenous and eat a bag of Doritos, which are not high in vegetable matter. So only 20% of Americans eat 5 or more servings of fruits and vegetables a day. We know that's a problem. We know, somebody mentioned McDonald's, we know that fast food is a terrible problem. We spend more money on fast food than on movies, books, magazines, videos, or reading material combined. That's a huge amount of money. In 2000, we spent more than $110 billion on fast food. So I should ask you, how many people have stock in McDonald's? Do we have stock? We do! I won. I'm so thrilled to hear goodness, do you have stock in McDonald's too? That was maybe not ethical, don't tell Father Lady, but, okay. People who exercise have 45% lower risk of heart disease, helps to decrease breast and colon cancer, and helps to do a lot of things like asthma and reduce hospitalization. Told you about the Lancet study, 15 minutes a day, 3 years more. And so one of the things I do tell myself when I'm going to the trainer in the morning, which I don't really like, is I could get up and do email. But if I email you at 7 o'clock this morning, you will have emailed me back by 8, which does not mean I'm ahead, because it's like kudzu in the South. You know, it just keeps on growing and you have more and more emails. So that it's not a good thing. Or I can go exercise. If I'm going to get 3 years, maybe that means 3 more years that I could spend with grandchildren. Or 3 more years I could spend with my husband, who I like a lot. Or 3 more years I can spend with my kids. Probably more fun than my email. So what is it that I really am willing to do that's going to make a difference? Okay, so who's added, this side of the room I'm going to ask because they were big on exercising. Who's added exercise to their life? Help us to think of a trick that helped you to do it. Yes? Stairs. So climbing the stairs instead of taking the elevator. It's better not to do that with people who, when you're talking, because then you're like, do it with a friend. It is easier to exercise if you've committed to somebody else than you feel like you really have to keep on doing it. People will be sad if you're not at the gym. So starting for something that you're willing to do, 18 minutes, if you're only willing to do 18 minutes, walking is a great thing to do. Buying a pedometer and seeing how much you are walking so that you have a way to say, how do I walk more? Building up to it, we don't all like to go to the gym and have other people look at us in these outfits. Although I have a really cute outfit now. Other things that this would be a nightmare. But this is good. You could have a very high energy dog. See, so that's somebody, so a friend or somebody else that's relying on you that you really need to exercise. Yes?
Schedule your exercise like it's a meeting, so it's in your calendar.
Yeah, I think that that's a really important thing. I have done an informal survey, and when you say to anyone, how are you today? What would you guess is the number one Family Feud says, Family whatever that game was says? Number one answer is, Fine. No, that's not the number. Tired is a good one, but that's not the number one answer too. I've really done. Busy. Who said busy? Busy is the number one answer. I don't know why we have to be so busy. But everybody, the number one answer is busy. How are you today? Busy. Oh, I'm really busy too. Oh, I'm busier. I'm so busy. This is like this commercial that talks about, did you go to the gym today? No, I had to call my mother. I missed the cat. Too tired. You know that commercial? It's Wednesday. It's Wednesday. There's always another excuse. So one question I really have, and this is a serious question, what are you willing to do? All those people who want to exercise more, what's the one thing that you're willing to commit to for the next 3 weeks? Okay, do you take the stairs now? Okay, so you're really going to work. When we see you next, tell us your name. No, come on, I'm saying commitment is a commitment. Nancy, if you see Nancy, I want the, how are the stairs going? We believe in social support. Other things you're willing to commit to? Okay, and you know, once you start doing it, once you write it down and you say, I do it Monday, Wednesday, and Friday, I don't think about it, I don't change my mind, this is when I do it, then you do it. Find something that you like. I mean, exercise does get to be fun. I can't believe I just said that. Well, you know, now I have all these conversations with my children that I didn't know how to have. So here's how it goes. Guess how long I planked for today? You know what a plank is? I didn't know what a plank was. This was amazing to me to figure out. Because, you know, these are all core body exercises. It's like you're doing a push-up, but you just have to stay there. And then, you know, they'll say how long, and I'll say, 60 seconds or whatever, which is very good. And then my husband says, yes, but did you do walking planks? That's a little competitive, I think. That's not really helpful to my moving along. Okay, so this is a sad thing, and we have to talk about this. Substance use is another really big problem. And nurses, and I'm only saying this because, you know, we know a lot and we're really good healthcare providers, and so I want you to know that if there's a problem for you or anybody in your family, nobody's alone. But we know that overall, 32% of nurses in this big study that was done reported that they either smoked or used drugs. Psych nurses were more likely to. ER nurses used a lot more cocaine. There's a lot of easy access to drugs, and it's a very stressful job. So one of the things that we really need to think about is what is it that's not okay in our lives that we're going to change? So here's the health assessment for you. So first of all, you really need to figure out if you're the correct weight. And how do you do that if you're not on the chart? That was a good question. So you take your weight and your height. You take your weight in pounds and you multiply it, this is a big number, but you multiply it by 704.5. Then you divide the weight multiplied by 704.5, you divide it by your height in inches, but inches squared. This is a lot of math. You need a calculator to do this. No, this is how you do it. This is the truth. So if your BMI is more than 25, you're overweight. If your BMI is more than 30, you're obese, which is a very bad word. Height in inches squared. And there are a lot of little things on the internet that you can put in your weight and height, and it just does it for you. There are BMI calculators. 25 or more is overweight. 30 or more is obese. Yes. Yes. That's even worse than obese. You're right. 35 or more is morbidly obese. Morbidly obese. So, you know, that's a way for us to think about risk. And the more overweight you are, the greater the risk there is that you're going to have cancer, heart disease, et cetera, et cetera. Yes. Yeah, so this is a great point. We do care. Where you carry your weight makes a difference. So people who carry their weight in their stomach, that's worse for you in terms of diabetes and other things than if you're big-hipped or have other kinds of, but it's not good. You can't sit there and say, oh, good. I'm very overweight, but it's all in my rear. That is not a good thing. But body type does make a difference in terms of risk too. Yes, but we all know that we comfort ourselves constantly with, we didn't gain weight, we're exercising, it's muscle mass that weighs more, but really. Weight is weight. Yes. So if you look at, you can look at charts that are different for men and women, and there are some slight differences, but overall, it's a very good indicator of where you are to get back down in range. Okay, so you have to think about, and one of the things, especially if you're here with somebody else, because I think social support is really important. So think about whether or not how many of you know whether you're normal weight, underweight, overweight, or obese? Okay, how many people don't know? Okay, so everybody knows. So everybody can sit there and say, do I need to change? And part of the other thing you're going to do in terms of this assessment for change is to think about, what did you eat yesterday? What did you eat for breakfast? What did you eat for lunch? What did you eat for snacks? What did you eat for dinner? And you can easily plot things and see, where are you? I'm going to show you the My Healthy Plate, which, as I said, changes from the food pyramid. And we in this country eat too much what? Way too much bread, way too much fat, way too much sugar, way too much carbohydrate. We need to eat more brown rice grains. We need to eat less of all of that. We eat too much fats, and we eat too much red meat. We do. Okay, so we need to figure out, not only are we the right weight, but are we eating well? Okay, so this is the healthy eating plate. If you Google healthy plate, that's the new thing that the federal government has to help you figure out how much you're supposed to eat. And I actually really like this. I'm going to scream so you can hear me. But what this is supposed to do is tell you, if this is your plate, you're eating a lot of vegetables. See how much of your plate is vegetables? A lot. You're eating some fruits. You're eating whole grains, and they're telling you that these are brown rice, whole wheat bread, whole grain pasta, not so much refined grains. And here's the healthy protein. Not a lot of milk, a lot of water. Healthy oils. Now, this is the healthy eating plate that the Harvard School of Public Health came up with based on what they found from the nurses' study. So I really like that also. And it's really sad when you look at the data, because it gets hard. We're great consumers, and we're really listening to what we need to do. But there was a time, and I remember this very well, that people were so against fats, and we thought it was all about fats. So people would think you were perfectly okay to have a bagel in the morning, don't have cream cheese, have jelly. That was good, right? Yes. I mean, people really tried very hard to change their eating based on what it was we thought was the best way to eat. And that's part of why we're not looking at the pyramid anymore, because that doesn't help you. You eat that, and then you're hungry an hour and a half later, and then you're eating again, and it's not a very helpful thing. So a lot of studies now that have really looked at what are our differences if we're adding vegetables. And if you go to any other part of the world, it's always very interesting to me to see in India, in Africa, in China, the amount of vegetables to meat. Yep, I know that. But there are things I can do. So some things are cheaper than other things. This is true, but there are things that I can do. And I can buy frozen vegetables if I can't get fresh, and I can buy canned vegetables if I can't get fresh. And you know, if I'm eating smaller amounts of things and I'm increasing my vegetables, I am particularly concerned about people who live in places where you can't even get good fresh. So that is not good, because she's not following My Healthy Plate. And I'm laughing because we have a daughter who is a vegetarian, has been a vegetarian for how many years? Like too many, but who was a vegan, which is the worst. I don't really think it's very healthy, actually. And she was very good about it and paid a lot of attention. You can eat very well if you're a vegetarian, and there are great cookbooks out for being vegetarian because you get plenty of protein if you're eating legumes and those kinds of things. And so part of the real question about what is it you need and what is it you don't need, so people eat a lot of things that I then worry about how things are processed and what's the story. So before I'm buying something that I'm going to find out is processed in a way that causes me to have problems, which is what I have, my concern when it comes to the powders and everything else, I'd rather eat real food that I know is okay. And there's a lot of legumes and a lot of beans and things that you can eat. Tofu, not easy at Christmas time, at Thanksgiving, but okay. Okay. My problem for her, my daughter, with the veganism was she started having headaches, and we spent $1 trillion on health care. Everybody thought she had some kind of weird migraine thing. I really think it was an imbalance, a micronutrient imbalance. And when I convinced her, it wasn't about the food, it was about the animals. She was convinced that cows did not like having to be forced to give milk. All right, I agree with this. But nonetheless, when she added a little bit of dairy back, it really did make a difference and the headaches went away. So you do have to be very careful, but I think you can eat a vegetarian diet really easily. Okay, so I don't know, I couldn't hear you, so I don't know whether everybody else could. So it's the vitamins to supplement what it is. Although so I do agree that multivitamins are a very healthy thing, but then there's a lot of discussion about how many and what's the right amount, which always becomes the question with things. Okay, so here's our exercise self-assessment. I regularly exercise, raise your hand. For how many minutes a day? 60, great. 20, excellent. An hour, 30. Okay. Doesn't have to be every day. 6 days a week is what people are now saying is really the helpful thing. You get to have a day off, but we know even 15 minutes 5 times a week was that study in Lancet said it was adding 3 years to your life. Interesting for whether you can up the amount you're doing, like moderate or strenuous. Different kinds of exercise do different things. So we're really interested in, are we doing things for balance? As you get older, you really lose your cerebellum function a little bit. And so people are not as good Tai Chi and all those kinds of things with balance, doing things that you're doing on one foot, the Bozu ball, all those exciting things really make a difference. But it's balance, strength training, and cardiovascular that make a big difference. We know we don't smoke, but if you did smoke, we were really going to have to think about, or for kids that you know that smoke, can we help you to think about how to ask, advise, think about follow-up so that you are getting smoking cessation? Do you drink or take drugs to get high? Do you take them by yourself? People who have a problem really do drink and take drugs by themselves. Has it helped you to be in conflict with your family? Do you hide your behavior? Does anyone think you have a problem? All those kinds of things would say it's not okay. So, what do you feel good about in your life? What would you like to change? How are you going to make changes? And these are really the questions. I think that there are every excuse in the world. I can't do it because I'm too stressed, I have no time, I can't do anything, and I don't have money. But here are the things that really make a difference. Deciding that you have a goal and not making it overwhelming. I'll lose 5 pounds. Make a plan that you can attain. So here are the big things that people really, really suggest make a difference. Don't have that food for your kids that you're going to eat. Or whatever, don't have something to drink that you like to drink if you don't want to be drinking. Have resistance bands if you're traveling, so that whether there's a fitness center or not, you can do exercise. Have some shoes that you don't mind walking in, so that you're going out and walking. Take the stairs in the hotel after you've made sure that it's a safe place to be. What is it that you're really going to do that's safe and that's realistic? What is it you're going to do that you think you can do, that you really have the capability to do? You know, it's hard if you have really young kids, for example, to get out in the morning and go to the trainer. What is it that you can do? What is it that is going to really help you in terms of your belief and your identity for who you are? So I'd ask you, as you're thinking about, is there one thing you're willing to change, what you could do to make your environment safer? I didn't buy any Halloween candy. It would be gone by now because I would have eaten it all. But I didn't buy it because then I didn't eat it. That made it a lot safer. What's realistic for you? So it took me a long time to weigh this much. I am not going to be thin in 3 months. Just isn't going to work. So what is it that I can realistically do? What are your biggest barriers to what it is you can change? People who tell you, oh no, you look great, you don't have to do anything, who like you to be the one that's always eating what they don't like to eat, food pushers, whatever it is. And you have to believe that you're worth changing. You deserve to be thin, not smoke, be healthy, whatever it is that it is. This is a great time to change because you'll be ahead of the New Year's resolution rush. Making new habits does take 21 days. So the big question is, what are you willing to do between now and Christmas? If you do it between now and Christmas, by 2012, you'll be a whole new you. And Boston College wants their alumni to be healthy. You're a great group of people, so why wouldn't we want you to be healthy? So it's really time to have this change. So let me ask you as we're closing, and then I'm happy if anybody has any questions. Just close your eyes for a second. And think about looking in a mirror and seeing the you want to be. Okay, we're going to get back to that image of looking in the mirror and seeing the you want to be. And so what is it about the you want to be that's different than now? If you bumped into somebody you hadn't seen in 10 years, what is it that they would see that would make you happy? And what's the one thing that you're really willing to do, ready to do, to help get from here to there? Because I do believe that the definition of insanity is doing the same thing and expecting you're going to get different results. If you want to get to that you in the mirror, it's that one thing you're willing to change. So I hope when we see each other again, you say to me, oh, you've lost more than that 30 pounds, which would be very good and I'm sure will be true. And I wish you all the success in the things that you're going to do to help us get to an affordable healthcare system, because we're not all having the chronic diseases as early or as severely as we would have if we weren't living a happy life. So I'm interested in meeting you, and when I do, please tell me what thing you did for 21 days, and all the best.